All right, here we are. Let's finish up on the chapter 11, part 2. I think we can cover everything with the goals that we have for these remaining parts here. We'll see how it goes. All right, so we're going to differentiate between microbes' pathogenicity and its virulence. Now, I'll just say right off the top here, the virulence is a degree of pathogenicity. So I know you have to think about that. Vocabulary is really important on microbiology in general. So I'm going to try to create a list for the chapters of the vocabulary. It won't be easy because, of course, the book company doesn't make that available, so I'm going to have to do it by hand, but that's okay. It's important enough, I think, to do that. So anyhow, we'll be looking forward to that with all the other things that are going on. List the steps that a microbe has to take to get to the point where it can cause disease. Explain the significance of polymicrobial infections. So multiple infections. Now it's obvious we like to think of the world as you get an infection, it's only one organism. Well, a lot of times it's just not the case. Lyme disease, one that you may or may not be aware of. Hopefully soon you will be from the course. That there's Borrelia burgdorferi is well known to cause, but there's also other organisms that can cause a Lyme-like effect and disease, and that's why a lot of times you get false negatives because you're testing for the wrong organism and that sort of thing. And so polymicrobial infections can be a really significant thing, and we'll talk more about that. We'll talk about the portals of entry and exit, infectious dose, and what that means. We're going to talk about several ways that bacteria can cause tissue damage, and then we're going to talk about characteristics of endo and exotoxins. Endo within, exo out, like an exit sign. In fact, Latin's the same, means to go out. Anyhow, we will go through uh, those, and then we're going to talk about virulence factors and what they could be and what it means. And it's always good to try to get a view, an overview of what's going on in terms of stages of a disease. And then we're going to talk about reservoirs, list several different modes of transmission. Something that I think is really important is healthcare associated infection, and we'll talk about the most common types, and then Koch's postulates, which viruses tend to violate, by the way. I just thought I'll bring that out. So, when colonization leads to disease. So, a pathogen is a microbe whose relationship with its host is parasitic and results in infection and disease. Now, I mentioned that the microbes don't set aside and just for the purpose of causing disease. It's growing in a niche, and if it results in an infection and disease, then we call it a pathogen. Pathogenicity is an organism's potential to cause a disease, and a true pathogen is capable of causing disease in healthy persons with normal immune defenses. Now, we typically think of a pathogen causing a disease in a normal patient. But my guess is a lot of the patients you're going to be dealing with are compromised in their immune system, may have other diseases that make them more susceptible, like COPD or things like that, chronic pulmonary obstructive disease. And those sorts of things will make them more susceptible to respiratory infections and various things. So, an opportunistic pathogen causes disease when the host defenses are compromised or when the pathogen becomes established in a part of the body as to not to harm them. And so that's an opportunistic. So, one of the questions might be that you have or are thinking of is, well, Dr. V, you said that an organism, it doesn't really sort of like plan, or it becomes a pathogen because that's its goal in life. And true pathogen, by definition, is capable of causing disease in healthy persons. And that's obviously, then it's one that is really kind of set up for that. And all I can say is to think about that initially it perhaps wasn't opportunistic, and through evolution has acquired certain characteristics because it likes that environment and it wants more of it. And so it evolves to become better at surviving in that niche. And so it's something to think about. And so that's the point I wanted to make on that. So virulence now is different from pathogenicity. Virulence is the relative severity of a disease caused by a particular microbe. So it's the degree of pathogenicity. And those terms are really important, the virulence and pathogenicity. And please email me if you don't see the subtlety of those terms. Those are important ones, and I just want to make sure we got that down. Virulence of a microbe is determined by its ability to establish itself in a host and cause damage. A virulence factor is any characteristic or structure of the microbe that helps contribute to establishing the disease and or causing damage. And a lot of these could be pili, or the attachment we're going to talk about in other chapters. And again, it's this basis that we're going to go over that covers how these become established and interact with the host. But I think it's important to go over that first. So now you see the relevance of studying things like pili or whatever we're going to talk about. And I think it helps with our understanding. The majority of infections are polymicrobial with contributions from more than one microbe. Now, if you think of tooth disease or occlusal or cavity, what you've had is a biofilm, then other organisms contributing, in Streptococcus mitis and all these different types of organisms, and they are dissolving the enamel of the tooth, and it's as a result of all these different polymicrobial infections. And so that's one example. Influenza infection frequently leads to pneumonia. And this again could be multiple causes by viruses of various types. So it's not really microbial. I call it polyviral. And you have multiple types. Several types of skin infections are caused by staph or strep. And when these two are cultivated with Moraxella, which usually causes pink eye, the three of them together lead to disease symptoms. So again, Moraxella is sort of an accessory to the crime, and it contributes to forming a biofilm and making an environment more susceptible for a staph or strep as one of the aspects to think about. So portals of entry, this is really important. Portals of entry are the route that the microbe can take to enter tissues and cause an infection. Exogenous, now X means out, exogenous, so these are microbes originating from a source outside the body. So the word exogenous is just one of those Latin words. Genus means to bring forth, and exo means outside, to bring forth from outside. And so the Latin words right there. So that's what I mean by systematically learning, is knowing the pieces and parts of the Latin terms. And it helps you not only say the word properly, but to understand its meaning. And so I will be posting some simple text. I'm trying to find one that you can download for free, but it helps you with medical terminology if you haven't already had it. Fortunately, it's not a prerequisite for your degree, but I would make it so just for myself. Endogenous, microbes already existing on or in the body. So endo means within, so it's generating from within. Normal, biota, or previously silent infection. And that can happen. They kind of held at bay, in other words, your immune system. But this first time that you experience a little dip in the immune system, and then these endogenous types of microbes can start to cause problems. Uh, so the majority of the pathogens have adapted a specific portal of entry, a modus operandi, I guess you could say, an MO, that they typically like to go, which is a favorable habitat for further growth and spread. And I would underline that and highlight it however you want. Favorable habitat. In other words, it likes to grow in those environments. If you make it available to them, they will grow and they will do whatever they're going to do by growing in those areas. So if certain pathogens enter the wrong portal, they usually won't be infectious. And they ask the question why? And that's an important question, of course. Otherwise, I wouldn't be going over it. But the inoculation of nasal mucosa with influenza virus will result in the flu. But if the virus contacts the skin, no infection occurs. This really shows you how important the receptors for adherence, and especially in viruses, they're very specific. The receptors are ones that touch a particular receptor like a lock and key. And if you don't have that exact receptor, that virus won't affect. And bacteria, if it doesn't have, let's say, the pilus to bind to, let's say, the epithelial cells of the urinary tract versus the epithelial cells of your throat, they're not the same. And so, therefore, the bacteria are not adapted for those types of environments that they prefer, and they won't usually cause a problem. And because they have to establish first that they can adhere and get in, and that's where we're at. Now, there are microorganisms that infect more than one portal because the tissue types are very similar. Mycobacterium tuberculosis can enter through the respiratory or gastrointestinal. We're finding out this nasty virus we're all kind of hunkering down over seems to be the same sort of type. We had reports of gastro types of disorders, and they attributed it to the virus in addition to a lower respiratory. So it's more than one portal, mainly because the attachment sites and the receptors lock and key type of thing. Strep and staph can enter through the skin, urogenital tract, and respiratory tract. Now, think about this. The skin tissue that surrounds the mouth is very similar. I know it sounds ugly, but it's very similar tissue type as the urogenital tract. And the respiratory tract may have certain characteristics similar to the oral cavity and some of the urogenital tract. So there's some overlap in general type of cells that these bacteria, which tend to be a little less specific than viruses. Viruses tend to be very detailed and specific. So here's some attachment specificity. No, I'm not going to have you memorize all of the diagrams. I wanted to make the point that it's not as simple as just, well, does it bind or not, or is it lock and key. Look at all the characterizations of various things that when, like Listeria monocytogenes binds to a particular surface feature, it has unique characteristics that allow it to do that. And when it does, it triggers various things within the cell, because a lot of cells have receptors that once triggered, now through normal systems, has a cascade of events. Well, some of the bacteria have learned that if they adhere and bind to some type of receptor, favorable things. It's like having a rat go through a maze and at the end gets a nice little treat. Well, it's the same sort of thing. The bacteria that don't produce this particular adherence mechanism don't end up getting to colonize. So the ones that do propagate, and they get more and more numerous. You can see that we've had sort of like a microevolution, that we're selecting for those that can do it. And this is what we see, a preponderance of this. And I hope that makes sense. I'm going to be going over that many times. But essentially, as it mentions here, there's some sort of trigger mechanism that the cell has learned just through random trying, I guess you could say. And then once it works, it's that microevolution that tends to select for it, because the ones that are successful, that can replicate and grow in those environments, because that's what they want to do, and then they win because the preponderance will increase because they've learned to go down a certain path, no different than a rat going through a maze. And so it's developed certain ways. And so there's certain things that can happen that triggers things. The portals of entry, and to be equal time. Now, there's a lot of similarities between male and female. Let's just look at the female and then we'll go to a male. But there are some differences. Obviously, broken skin, insect bite, kind of the same between having the orifices with the anus, and then you have the mouth. And we all know various things, but the female, of course, has differences in being able to carry babies and that sort of thing, and breasts and things that can serve as portals of entry for various things. In the male, of course, some of the subtle differences, the urethra is different. And believe it or not, there's a lot of diseases that take advantage of the fact that the urethra, the passageway, is longer, or it's more pronounced in males than it is in females, and certain diseases may or may not form as a result of that. Um, some of the other characteristics not even listed in this image are certain characteristics of male and female. Men tend to be a little bit more adventurous, perhaps. I'm not always saying that. I'm just saying that we might see broken bones and other things that can serve as portals of entry just because they're more stupid. No, I didn't say that. I'm just saying that there is a difference that we've seen. So the portal of entry of skin, of course, the skin is the largest organ system, and there are microorganisms that are constantly growing on our skin and waiting for a nick or an abrasion of some kind or a puncture. And Staph aureus, MRSA, methicillin resistant Staph aureus, is all over our skin. Streptococcus pyogenes, which is a nasty form of strep, as we'll see, and it can cause all sorts of things. And you had a case study that kind of went over that. Clostridium tetani causes tetanus, and a lot of times this organism forms spores that can exist in soil, so you can have it on your foot. But stepping on a rusty nail is a typical kind of thing that we see, and you should have your tetanus vaccination, so if the spore does germinate, we can stop it. Otherwise, you'll get muscle contractions that are most painful and can be deadly. Herpes, type 1, via mucous membranes of the lips, and you can see whenever you see a sort of a raising part of the skin that's a clear liquid inside, well, that's highly infectious. There's a lot of viruses in there waiting for other types of tissue, similar types, to infect, because, well, that's what it wants to do. Helminths and worms burrow through the skin, and again, it depends on how much. If the skin is moistened or something consistently, it can allow it to burrow easier. Viruses, rickettsias, protozoa via insects. So we typically see that as talking about vectored. In other words, they're carried by certain insects or other ways to do that with animals and things. But talking about insect bites. And so they may not serve, it doesn't infect the insect, but it just serves as a way to deliver it. A mosquito, I think of it as an ideal way of just injecting everybody. Haemophilus, Aegyptus, chlamydia, trachomatis, conjunctiva of the eye, Neisseria gonorrhea, all those sorts of things can get into the eye. And cause similar types of things for the skin. And some of these can be really serious. The gastrointestinal tract, of course, we're going to talk about Salmonella, E. coli, Shigella, Vibrio, poliovirus, hepatitis. If somebody doesn't wash their hands and prepares that sandwich that you're eating, God help us, you get the hepatitis. Uh, Echovirus, rotavirus, which causes a really nasty disease, diarrheal disease in children, and you can get it from animals. Enteric protozoans, Gardiolambia, and Amoeba histolytica, and those can be very standard pathogens you may or may not see about, but usually through contaminated foods, fluids, or inanimate objects contaminated with these infectious fomites and things like that. Respiratory tracts, bacteria causing meningitis, influenza, measles, mumps, rubella, chickenpox, common cold, streptococcus pneumoniae, Klebsiella mycoplasma, cryptococcus, pneumocystis, Mycobacterium tuberculosis, and histoplasma. Those are mouthfuls, a lot of different viruses, bacteria, different forms. And you can get these by inhaling them and getting them in a location where they can grow. And they like the niche and they'll stay and hang around if they can. A lot of these will produce a polysaccharide or a slime like layer that hides it from your immune system so it persists. Because of the lungs, once we get things in, it's harder to get them out. We have that elevator with a cilia action that moves that mucus constantly upward, but the problem is gravity wants to keep things down, and if you smoke or have damage and the ciliary action doesn't happen, you can see that you're even more susceptible. And a lot of these have very specific receptors and can cause persistent disease like chickenpox and common colds and things like that. Your genital tract, HIV, trichomonas, hepatitis B, syphilis, treponema pallidum, the Neisseria gonorrhea, chlamydia trachomatis, herpes, genital warts, and the list goes on. And a lot of these, due to social meetings and things like that via social media with cell phones and the like, we've seen increase incidences of these things because, well, it enables folks to be a little bit sneakier and to find partners and things. But ultimately, the bacteria love that. That's a great thing. You know, we might as well call it let's supply the portals of entry app that you have or something like that. Enter through the skin, mucosal of the penis, external genitalia. It's things that can enter through an unbroken surface, a cut or abrasion, and a lot of course the various things that happen can complement or augment the bacteria from getting in. And unfortunately, that's not what a lot of people are thinking at that time, and so that's why we get these sorts of things. So needles, insect bites, broken skin, urethras, and of course having sexual transmitted and various things like that help facilitate the spread through the portals of entry. And so that's the first thing you want to identify in triage, of course, is to find out why somebody might be sick, and you want maybe do a skin search to see if there's a portal of entry or ask them questions about activities and things like that. And that's why triage is so important. It follows with this. And then there's this infectious dose concept, and I don't want to get carried away with this. But it's the minimum number of microbes necessary to cause an infection to proceed. How many licks does it take to get into the inside the one of those sugar pops or whatever they're called? And there is a certain number that has been established for some of these by the CDC and other places that is quite interesting. So microorganisms with smaller infectious doses have greater virulence. Let's think about that for a second. Virulence is the degree of pathogenicity, so the more you have, the more likely you're going to get infected, and the more likely it's going to be more pathogenic. Hence, its virulence, in other words, its degree of pathogenicity, would increase. So the infectious dose, which is usually abbreviated as ID, for Q fever is a single cell. Coxiella burtonati is one of those that can cause Q fever. It's very effective in terms of getting into the niche that it enjoys. ID for tuberculosis, giardiasis, coccidiomycosis is about 10 cells, and these bacillus organism for tuberculosis, and then giardiasis is a different type of pathogen altogether. It's we're going to talk about parasites, and coccidio idomycosis. So it's a small circular type that we don't really know where it comes from, but it's a fungal-like infection, and so that's that one for about 10 cells. Gonorrhea is about 1,000 cells, which in bacteria terms, and Neisseria gonorrhoeae, that's not that many, given the fact that that particular organism doubles every 60 minutes or less time, depending on its environment. We can get 1,000 cells in a matter of about 4 or 5 hours, and so that's pretty scary. ID for typhoid fever is about 10,000 cells of Salmonella typhi, and again, Salmonella is about 20-minute generation time. In other words, it doubles every 20 minutes, and 10,000 cells is nothing. It wouldn't take very long. Cholera is about 1 million, and Vibrio cholera, well, that's 1 billion cells. Vibrio cholera is again a very fast-growing organism, and cholera is just one of those that's intestinal, and you could easily get that number of cells with an infected sandwich or something like that, and be sorry you ever did. So step 2 of becoming established is attaching to the host cell. Adhesion, process by which microbes gain a more stable foothold on host tissues, depending on binding between specific molecules on both host and pathogen. Pathogen is limited to only those cells and organisms to which it can bind, and firm attachment is always a prerequisite for causing disease. So, of course, that's fodder for a test question. I mean, that just obviously, firm attachment's almost always a prerequisite. So what are one of the things that causes, bacteria will need to do in order to establish the disease? It's got to have a firm attachment. We have so many mechanisms for flushing microbes. You think about the urinary tract infections, and you're constantly flowing out pH, probably lower pH, and it's just the flushing effect. But if the organisms can adhere and overcome that flow, bad news for you. And so that's what they can do. So bacteria, fungal, protozoa pathogens attached by pili, fimbriae, usually bacteria, surface proteins of some kind, and its shape and charge, and it fits a receptor, or it has a compatible, if there's a negative charge, it's got positive, and vice versa. And then adhesive slimes. If you, let's say you have a an all-day sucker or something, you've been licking on it, and you dropped it, or you left it on the seat of the car or something like that, and you go to pick it up and it's like stuck to it. Well, it's because these capsules are made out of sugar, and because of the sugar's nature of it, it's sticky. And these adhesive slimes or capsules or this sugar actually help these organisms stick to things, and it's part of the pathogenesis. And it's expensive for the cell to produce those, because obviously it wants to eat the sugar for its own, but those that secrete it and put it on the outer part survive, and there you go, there's your microevolution. Viruses attached by specialized receptors. They're tissue specific. It's a lock and key, and that lock can only be unlocked if the virus has that right key. Or in other words, I use that as an analogy because in order to adhere, it has to have the right shape, charge for a particular receptor. parasitic worms fastened by suckers, hooks, and barbs, and we'll talk about that, but it is very true. Adhesions, they allow bacteria uh, to bind to host cells, fimbriae, bacteria cell walls, capsules, and the like. And you can see the receptors for closer contact absolutely required. And so when they adhere, it could be adhesions of proteins and things, but you can see the adhesion receptor. Now that could be used for something else, and most likely is. Obviously, I don't want to grow and have receptors that are just for the pathogens to get in. Why would I want to do that? But these cells sort of have evolution for other receptors that have been proven for them to be useful for the purpose, and of course, again, the ones that do propagate and it becomes more of them, so you're selecting for the ones that can cause these diseases. And that's why a lot of times we see these infections in hospitals and things, because the probability of these finding the right places are much higher in that case. Firm attachment's always a prerequisite for causing a disease. So if you want to see if somebody has, let's say, sore throat, and you want to see if it's infected, there you go. You can actually see physical evidence of these microorganisms attaching. And so it's part of the nature of this. So now once you become established, you got to be able to survive the host factors to try to clear you. Of course, that means the immune system. So phagocytes, cells that engulf and destroy host pathogens by means of enzymes and antimicrobial chemicals. So antiphagocytic factors are virulence factors used by some pathogens to avoid phagocytes. So those are things against being eaten or engulfed. And so anti means against, phago means eat in Latin, cytic factors, and cytic means unusual condition of cells that have non-eating characteristics. I guess you can look at that, interpret that from Latin. Virulence factors used by some pathogens to avoid the phagocytosis. So we call it a virulence factor because it's involved in its ability to establish the infection. Now, did it devise this in the system prior to it? Well, it evolved, so it had to have some prior contact in order to evolve that. So those who are successfully do this have learned to avoid some phagocytes. Leukocidins kill phagocytes outright, so producing a cidin. So just as a general rule, any word that ends in an in, leukocidin or cidins, with an in just means it's a protein of some kind. And then what is it? Well, it's a white blood cell, and it kills white blood cells. And so the word kind of tells you its meaning, and that's systematically learning it. Kills phagocytes outright. Extracellular surface layer, slime, or capsule makes it difficult for the phagocyte to engulf the pathogen. Now, the reason it makes it difficult is it surrounds itself with sugars and things that are normally present, and it's considered off boundaries. That would be self, and we don't create immune responses to self. And so that's a sneaky little thing that bacteria have learned to do or evolved to have that trait, is it covers itself like a shield that the immune system won't see it, and won't because it's something that's self material, and that's how it makes it difficult for the phagocyte, because it has to recognize. We'll learn that in chapters 12, 13 or so in the immunology. Some bacteria survive inside the phagocyte. I studied a disease, E. coli can do that. As part of the pathogenesis, no one had ever seen E. coli actually getting into the phagocyte, and we saw that it actually in fact did, and that's how it was very, very difficult to get rid of the pathogen that caused femur head necrosis, because it had that characteristic. Well, it evolved that. Virulence factors are simply adaptations a microbe uses to establish itself in a host through evolution. So directly through the action of enzymes or toxins, which we refer to as endo, within, and exo, without, outside toxins. Indirectly by inducing a host defense to respond excessively inappropriately. So there's a lot of verbal abuse, I'm just joking, but it provokes the host to over respond, hence causing tissue damage and then making it easier for the microbes to get in. So they've learned to do that. The ones that successfully were able to over agitate the host and cause tissue damage, they were more effective in getting in and causing disease. So those seem to be propagating, and more the preponderance of that, or the evidence of it in nature, became higher because it could do that effectively. Epigenetic changes made to the host cells by microbes. Now, epigenetic just means, epi means on top, like an epidermic needle, and changes. So it's genetics that are changed at the top, or some environmental effect or something like that. So it's epigenetic, made to host cells by the microbes. So the microbes are changing sort of the host genetics at the local site there, in response to the environment of the bacteria being there. So epigenetics is the study of heritable changes in gene expression or heritable phenotype that do not involve alterations of the DNA sequence. So it could be that it's modified features due to some environmental effect like methylation and things like that. The sequences aren't changed, but it's how the DNA expression is altered. And so you can look at microbes secrete enzymes and toxins, and the enzymes can devour certain things, like if it has there was a pathogen I studied, Alkaligenes faecalis, that produced alkaline, and it produced an ammonia-like substance. Well, the ammonia-like substance actually contained chemicals that liquefied cartilage. And that's really, you think about that, of course, our throat structure is cartilage, and if it makes it like water or very weak, it collapses. And part of the disease process of Alkaligenes faecalis is that it collapses the tracheas and you suffocate as a result. Or the animals will suffocate in various places. So that's a really important thing, is access and exotoxins and bacteria's ability to produce things and cause these effects and tissue damage as a result of enzymes or some substance, exotoxin, that they produce. And so host defenses do the damage. If you block some organism that's trying to engulf microorganisms and is blocked, and then of course the system that specialized network with the lymph tends to get a little bit polluted, and we start to see swollen lymph nodes and things like that. Well, hey, that gives the doctor something to detect, and there's certain microorganisms that might do that. Give you a clue. But microbes induce this epigenetic change in some cases, a DNA methylation or some change, and the DNA doesn't fold right or whatever, and that causes these changes. Now that could lead to colon cancer or things like that. It could be really, really nasty, which would be epigenetics. Helicobacter pylori. It causes ulcers, and of course this has been, something that the pharmaceutical industry has been using these antacids and things to kind of offset the ulcers, but no one would have thought that this microorganism could grow in those really hostile low pH environments as it gets close to the digestive system. But that's part of the pathogenicity of Helicobacter pylori. In addition to it survives by neutralizing those gastric acids with urease, breaks down urea, adheres to host cells and causes inflammation of the lipopolysaccharides. It has pilus-like injectors or structures like that to adhere, and then it has effectors that causes the cells to get a little bit denser. It's sort of like trying to create uh, a scab or something where you get this additional structure, and in doing so, it thickens the area so our immune defenses don't get in there. Other enzymes like mucinase, which breaks up mucus, proteases that break up proteins, and lipases, any word that ends in ASE is an enzyme, and then whatever it's attached to is the enzyme that breaks down it, like in case of lipids or fats. ACE is here for proteins, and ACE is here for mucin, which is another name of having mucus effects. Exotoxins, vacuolating toxins, causes it course those long extended gastro and mucosal cells, and what it does is it causes the center of them to and form this hollow part, and they collapse and causing that mucosal injury. And so there's all sorts of things. It's been well studied, and it's proven that that's what's going on. So extracellular enzymes, you can see the exo enzymes and extracellular enzymes to relate. Enzymes secreted by microbes that break down and inflict damages on tissues, dissolves the host defense barriers to promote the spread of disease. Examples of these enzymes are mucinase. Mucinase digests protective coating on mucous membranes. Hyaluronidase digests the ground substance that cements animal cells together. So that's part of sort of the from cell to cell. So you get this sort of liquefying between cells. Hyaluronidase. Coagulase causes the clotting of blood. So there's a feature, this enzyme breaks something. It's like taking the cap off of super glue. It immediately hardens, and so coagulase will break down a substance that causes the clotting of blood or plasma, and so by cleaving it. And kinases dissolve fibrin clots, so clots that start you leaking again, and what they're trying to do is to open the door so it can get in and pass it around. Mucinases and Sialidases, you have sialic acids, and Sialidases, best way to say it, I guess, contributions to the process of invasion and colonization. What it's trying to do in this case is break down the cervical mucosa and pathogens of sexually transmitted diseases. So you have all sorts of flagella allow it to move, and we'll talk about that. Flagella is like little engines that spin, and in one direction it moves forward, in another direction it wails around, so it changes direction. But we'll talk about that, and that's called chemotaxis. But the idea is it moves in, it adheres to the fimbriae, so it can literally motor there, get there, attach, and then start to cause effects through very specific mechanisms. And so I also encourage you, by the way, I'm going to have several assignments that will have you read a research paper. I think you have got to not fear research papers, and there's a certain way to read them, and they're very helpful. One of the reasons I like to use research papers is they give you a concise sort of survey of the literature for you. They've already done a lot of the work for you. So here's an example. Group A strep, we're going to talk about, depends on hyaluronic acid capsule to evade, and it'll go through the whole history for you so you can kind of get up to speed really quick without having to do all that research yourself. And that's one useful use of research papers. And so I just wanted to introduce you how to read those and effectively use them to your advantage. Bacteria toxins, a very potent source of cellular damage, a toxin. I studied toxins when I was at Burris Wellcome. I worked with a enteropathogen, a bacteria, E. coli, that produces a very well-known enterotoxin, and they're nasty and they're poisonous. And there's reasons why. They may do it to exclude other bacteria from colonizing, but also to elicit that damage so it can get in and gain entry and do things. But neurotoxins act on the nervous system, pretty straightforward. Just as a general rule, O's and I's, vowels usually are connectors that tell you from the neuro and a toxin, so there is a connecting vowel. Entero, intestine, toxins. Hemo, or blood, lyse red blood cells, hemotoxins. Nephro, which is kidney, nephrotoxins. So you get used to that. In fact, I used to make students when I taught anatomy is to always break the words down and to reveal, let the word tell you what it is, and that's important. So I'll give you a few minutes to memorize this. Just joking. I just want you to see, looking at all the different types of neurotoxins, and you go by classes. In other words, sodium channel blockers, activators, prolongers, potassium channel blockers, calcium blockers, nicotinic receptor antagonists. I mean, the list goes on and on and on and on. And these are just from these types of microorganisms. So a lot of what you studied in anatomy apply with that neuromuscular junction. So we go electrical, as you see the sodium and potassium, which those could be disrupted. So you have that electrical, then it converts to a chemical, which then again now affords a new electrical connection. But it is that synaptic junction right there that the chemicals can have exogenous, or chemicals coming from the outside that trigger certain things, which bacteria can do. So you can see neurotoxins aren't, conceptually at least, that hard to disrupt or cause, because it allows these substances to get in and block various things. It shut down a sodium channel, or have something persist longer, and it'll just mess up or totally cause dysfunction of a particular, let's say, a neuromuscular junction or something like that. And so I just wanted to kind of illustrate what a neurotoxin can do. Enterotoxins, typical enterotoxins can be formed by Clostridium difficile, C. diff, which is really nasty. You can write it in a margin there. Explosive diarrhea. It has an odor that, well, we'll just leave it. It's one you'll never forget. Clostridium perfringens, another one that produces a rather pretty nasty odor. And it's a Clostridium enterotoxin, but perfringens will cause rotting of the skin, and that is really nasty. So perfringens, or gas gangrene, you may have heard of that, is pretty ugly. Vibrio cholera causes, with the cholera toxins, it disrupts the normal water absorption and the like pattern, so you have diarrhea and vomiting as a result. Staphylococcus aureus, the enterotoxin B, so you can have the staph growing on potato salad for a couple hours. You go to eat it and you get sick within 2 to 3 hours. Most likely it's the enterotoxin B, and you wish you'll never eaten that. You'll be sitting on the commode for quite a long time if you're not vomiting. Yersinia enterolytica, yersinia disease is pretty severe. Has a characteristic timing and everything, as does Shigella dysentery, the Shiga and it too can cause rather significant changes in the gut's balance of fluids and the like, leaving this poor child. I mean, think about this. He's everybody's been through this, and my daughter paid for cruises with a particular type of virus that causes the diarrhea and vomiting. So you got a bucket to deal with, so you can catch the vomit while you're sitting on the toilet. So enough of that. So hemolysins, and we're going to see, at least graphically, that we use blood agar. This is bacteria growing. It's been inoculated using aseptic technique on agar, and you can see 3 different sort of reactions that happen, and the bacteria can produce a hemolysin and absolutely clears the area around it. You could read a newspaper through that. It's so clear, and it's because of producing this hemolysin. And it literally breaks down red blood cells. So it hemolyzes blood, it bursts the cells. So the red blood cell just blows up, and then you leave that clearing zone, that serum-like color. And then you have microorganisms that really don't produce a hemolysin. It produces hydrogen peroxide, and it causes that sort of characteristic type of hemolysis-like effect. But it's really certain organisms can do this that are typically known to be somewhat pathogenic. These are usually your bad boys. These are the really bad ones, the ones over here. So there's alpha, beta, and gamma. So beta is bad, so that's what we're looking at here. This is a beta type where it has that clearing. Gamma, there's nothing going on. It's just bacteria growing on there, but it's not doing anything to the red blood cells. And then you have alpha over here where you see that clearing. It's usually greenish in color, and it doesn't anywhere near make that clearing zone, but it's hydrogen peroxide kind of affecting the integrity of the red blood cell. So we'll talk more about that in the lab part. Lipopolysaccharide, LPS, is part of the outer membrane of gram-negative cell walls. It has a great variety of systemic effects on tissues and organs. Causes fever, inflammation, hemorrhage, and diarrhea. Blood infections by Salmonella and Shigella, Neisseria, meningitis, and E. coli are particularly dangerous and can lead to gram-negative shock. So I'll go ahead and mention it now. But endotoxins, a lipopolysaccharide, one of the things that are concerned with doctors, well, we can solve these by giving them high amounts of antibiotic and clear them. Well, the concern is you don't want to clear it too fast. That will overwhelm the kidneys and other organisms that are susceptible to that gram-negative shock. And so you want to do it maybe not as aggressively and allow the body to clear and deal with it on a basis that has been pretty well established, but you slow down the healing. And that sounds counterproductive, but no, you want to clear them on a particular descent rate so that you don't trigger the host. Now, well, we were successful in the treatment, but the patient died. We don't want that, for multiple organ failure or pH change and things like that. All right. So, origins and effects of circulating exotoxins and endotoxins. This is a great little chart. And if you look at characteristics in high doses, and endotoxins is usually toxic, and exotoxins are in very small, they say minute, not minute, those are minute, in other words, really small amount, and they're toxic. So there's some differences between the exo and endotoxins, and this is an important one because you wonder why there's certain exclusive type of features. Endotoxins usually are fever generators, and in exotoxins they're specific to a cell, a blood or liver cell, and induces a tumor factor, which results into a fever, and it has a totally different type of fever effects, and to an experienced clinician you might be able to determine that. Small proteins, chemical composition, we call it exotoxin. Lipopolysaccharide, which is an endotoxin. Unstable toxins, exotoxins can denature at 60 degrees, where a lot of endotoxins are stable. Can be converted to a toxoid. Oid just means it has similarity to, it's not identical. Toxoid formation. And endotoxins cannot be converted to a toxoid, but endotoxins can, exotoxins can, and stimulate antitoxins, immune response. So you get immune response that takes out the effect of a exotoxin, and endotoxins can't be converted or well, um, the antitoxin cannot stimulate antitoxin. It doesn't work. So the idea is that endotoxins you can't create or you can't get vaccinated against, that sort of thing. Exotoxins, as far as fever stimulation, we just don't see it as frequently with exotoxins as we do with endotoxins, and that's usually the characteristic that docs look for. Usually high ones too. Secreted from a live cell, a manner of released by cells via shedding or during lysis, and so you see the manner at which the exo or endotoxins are released. Few gram positive and gram negative exotoxins, and the endotoxins are always gram negative, so there's a huge difference between these two there. So this is a good chart to study and to generally know, because you're going to come across this in your career. So leaky gut is something I wanted to mention. One of the things you're going to find that your patients don't eat very well, and like high fructose corn syrup and various things, they all have an effect. And it sort of predisposes a host to other types of things, weight gain, diabetes, and various things, because it's an impaired gut barrier. And then it gives you more susceptibility to LPS effects or toxic shock and that sorts of things. But I would say leaky gut is very it's pronounced. Many patients will have this, and there's just a gluten and various things. Well, I may not be gluten sensitive. Well, I bet you, if you did a test for your inflammation, there's a test that you can run that kind of looks at inflammation. If you have a higher inflammation marker as a result of that, the C-reactive protein, the CRP test, if that's high, I would stop eating gluten and see if that number comes down. There's never a case where inflammation over a long period of time is good for your patient. It's just not, especially in men. If you ever wondered why retirement homes seem to have a higher proportion of women to men, well, inflammation might be your answer, because it tends to take out men a little bit earlier in age than it does in women. Unfortunately, that's the way it is. But leaky gut's caused by lots of things, and probiotics can help. Our diets will eliminate certain bacteria that grow in our gut, and we want to replace those. If you've had antibiotic therapy, it's good to encourage eating yogurts and things to try to reestablish some of those bacteria to cut down on leaky guts. But we're going to talk more about that later on. Definitions of infection types: localized versus systemic. It's pretty obvious, but localized enter the body, remain confined to a particular tissue, boils, warts, fungal, skin infections, and things. Systemic infections spreads to various different sites, usually through the bloodstream. So mumps, rubella, chickenpox, syphilis, typhoid, that sort of thing. A focal infection, that's an infectious agent spreads from a local site and then is carried to other tissues. So you want to find where the foci infection or the focal infection started, and to know the type of organism where they might be spreading to. Tuberculosis, streptococcal pharyngitis, that sort of thing. Polymicrobial infections. Several agents establish simultaneously at an infection site, because once the portal of entry has been opened, anything can go in, and the key comes down to which one can survive. And sometimes multiple organisms enable each other synergistically. Human bite infections, wound infections, gas gangrene, things like that. Primary infection is the initial infection, can be anything that starts. Secondary is caused by different microbe, which complicates. It's usually a secondary infection. And a good example is, everyone's been through the flu, and you get the flu, and then the next thing you know, doc's giving you an antibiotic. Well, the flu has weakened your immune system to bacterial infections, and then you're going to need some sort of treatment to get rid of the bacteria. And ear infections and things in children usually follow a flu or some other infection. Acute infection is an infection that comes on rapidly with severe but short-lived effects. So you can have this like massive uh, reaction or effect, and it's just short-lived. That's an acute infection. Now, influenza, most doctors would tell you that viral infections are self-limiting. In other words, yeah, I'll make you feel more comfortable, but you're going to get over it. You're going to fight it. A chronic infection, sort of like Lyme disease or HIV, is an infection that progresses and persists over long periods of time. HIV destroys part, if you actually have AIDS, it destroys part of the T helper cells, and that means your immune response has been greatly handicapped. Or you can have Lyme disease with Borrelia burgdorferi that goes to poorly vascularized or low oxygen areas and hangs out, which means that if you take antibiotic, we can't get antibiotic to those poorly vascularized regions, and it persists and it's chronic. And that's one of the issues of Lyme disease. Okay, warning signals of disease. This is something you'll come across in nursing all the time, but you're going to objectively look at evidence of a disease as noted by an observer. That's a sign. You know, it's not going to be a little sign that says this patient has this infection, but it's going to have symptoms. Now, the biggest tattletale of a human body, two places: the skin, and you can look at somebody has syphilis. You can look at their feet, for an example, to see skin lesions. Or the eyes. The eyes in the veterinary side, you can look at eyes to look at health, high blood pressure, all sorts of things through the eyes. It tells you a lot. Doc always said it's the windows to your body, and they are. And so we use these things as signs that help us identify what's going on. A symptom is a subjective evidence of a disease as sensed by the patient. Unreliable a lot of times. Well, I feel this pain right here, and they're pointing to their stomach, and it's not really the stomach, but it could be an organ that's near it or something like that. It's a symptom, and it's up to the healthcare professionals to sort all that out. A syndrome is a disease identified by a certain complex signs and symptoms. So these are, again, connected so we can diagnose a disease based on certain complex of signs and symptoms that say, okay, well, we typically see this as a chicken outbreak of the type of virus that causes chicken pox, something like that. Symptoms of inflammation, fever, pain, soreness, swelling, the color, touch, it's really sore, as they say, with redness and that sort of thing. Signs of inflammation it always occurs with some sort of accumulation of fluid, so you get an edema. The severity of having granuloma or an abscess, it depends on how long it's been. The lymph system, where the adenine or the adenoids inflammation, so you have swollen lymph nodes, depends where they are, could be in the groin area, around the chin, under the armpits and that sort of thing, and usually have certain characteristics. Now, these are important when we run standard blood panels. These are run routinely, and if somebody reports a blood panel for me, I look at leukocytosis. If I had an increase in white blood cells, it might tell me something about what type of organism is infecting. Leukopenia is a decrease in white blood cells. So increase and decrease. Penia, you got to write things down with a pen. That's one way, a memory trick for me. I say leukopenia, so down, we're writing down with a pen, so that's a decrease. And leukocytosis, it's an unusual condition of cells, white blood cells, so that's an increase. Septicemia is a general state which microorganisms are multiplying in the blood, And so emia, the emia part is blood, so it's an unusual condition of the blood, and you have sepsis. In other words, you have some organism growing in the blood. What's particular type of organism? Well, bacteremia. So we have an unusual condition, IA. Emia, or the eme part, is in the blood. And what's in the blood? Bacteria. And the same with this, emia is blood, an unusual condition with viruses. So bacteria and viruses in the blood multiplying, and systematically learning that. So you'll have that. Infections that go unnoticed, no noticeable symptoms are produced. Microbe is active in host tissues. Host does not seek medical attention, and this is known as asymptomatic or subclinical. Now, we've heard that term, unfortunately, with this virus, that you may have the virus, the coronavirus, and you're asymptomatic or subclinical. And really, what you're doing is you're one of those typhoid Marys, and you're going around spreading it. You don't know it, and you're not doing it on purpose. So, and step 5, vacating the host, the portals of exit. This is just as important as the entry from the standpoint of spreading things, but a portal of exit is the specific avenue by which pathogens exit, shed through secretion, excretion, discharge, or sloughing tissue. High number of microbes in these materials increases in the likelihood of the pathogen will reach other hosts. Portals of exit is usually the same as the portal of entry, but some pathogens use a different route. So they're pretty straightforward, but the idea is, the key is high numbers of microbes in the materials increases the likelihood will reach other hosts, and we worry about that. So here's the major portals of exit: coughing and sneezing, which we know about. And a lot of times we can be vectored by insect bites, and you're carrying malaria, let's say, from one. Removal of blood, so we always have to wear a face shield and be careful. This day and age, we just don't know if they have AIDS virus or something. The feces can carry all sorts of things, and again, you want to take all the precautions in the world. You may be doing a catheterization or something. You always want to use new catheters. I know that sounds like obviously, but there are cases where we read about people getting recatheterized with used stuff, and you'll get an infection of some kind. Skin cells, open lesions and things, susceptible to MRSA and things like that. So pretty common sense oriented. So steps involved when a microbe causes disease. We find the portal of entry, which we've talked about: the skin, the GI tract, respiratory, urogenital, and endogenous biota, the things are growing within. Attaching firmly and negotiating the microbiome. That's one of the things I didn't emphasize, but I want to make sure that I connect, is that you got to use fimbriae, capsules, surface proteins, viral spikes, but a lot of times you have a biofilm with other microbes that are helping that as well. And so the microbiome, and your first paper you're going to have to review is one on biofilms, and I'll make that available soon. And you can just read through that and then make comments, and it's an easy way to boost your grade. But it shows you how to use and effectively read a research paper. Surviving host defenses, avoiding phagocytosis, we've talked about that. Death inside a phagocyte, and absence of specific immunity is just the general. Causing damage via enzymes or toxins, causing some sort of change in the host that gives the bacteria an edge. And then you have the portals of exit and that sort of thing. So I am decided as I go. This seems I blab too much. It's longer than I like, and I have some more to go. So I'm going to end this as part 2, and there will be a part 3, and we'll go over some additional vocabulary as we go on, talking about latency and various things, incubation periods and things. So I'm going to stop here. And this is a good summary of everything that we've really spent a fair amount of time on, and I hope this has helped for you. I have posted some pre-test just some questions so you can get a feel for. It's a good way to know how some of this material might be asked. So that's been posted for you, and I'll continue to do that throughout. I will create a different version of this video that has embedded questions in it. I'm doing that as a test feature to see if that's useful. Sometimes it's distracting, and so I do it as a post, so I have to learn to pause a little bit, so I allow certain entries of various things, and I'll catch on to that. But before I spend too much time, I want to make sure that they're useful, so I need your feedback. And on a role polling that I will do, sometimes I ask questions about that, so I have the feedback that I need to make sure that I'm doing the best I can in terms of delivering this material. I hope this was useful, and I'll see you with part 3 soon.